Most people never look twice at what's in the toilet bowl before they flush. Okay. But if you paid closer attention, your botany has been leaving you consistent, honest clues about your health every single day sitting there in plain sight. But almost nobody knows how to read or interpret them properly. Today, I want to make you an expert on your own urine. I know that sounds a little bit gross, but your urine can tell you how good your health is. And there are a few unusual colors, including one color that I'm sharing at the end of this video, which even surprised my dad, a retired urologist, that can give you an insight into a dangerous process that may be occurring inside your body. This video, and this is for my dad, I hope this makes you proud, as I do consider you a urine expert. Let me start with the one color that requires the most immediate attention more than any on this entire line list. Now, the blood we have inside our bandy is supposed to stay inside blood vessels. If you see it in the toilet bowl, something in your urinary system is leaking. I want to walk you through a real patient scenario as to why blood in the urine matters so much. A man in his mid-50s came to see me after noticing pink-tinged urine. He almost did not book the appointment because he felt completely fine with no pain, no issues, nothing dramatic at all. He assumed it was probably something he ate, but it did not go away. So we investigated it, and it turned out to be an early bladder tumor. Because it was caught early, it was treated successfully, and he's doing well today. But if he had waited 6 months because he felt fine, that story could have ended very differently. Now, here's the important nuance. Blood in. The urine does not always mean cancer. In fact, most of the time, it doesn't mean cancer. It can be a bladder infection, a prostate issue due to kidney stones, or even the result of vigorous exercise. But the rule stays the same regardless of the underlying cause. If you see red or pink urine at any point in time, you book an appointment to see your doctor, not in 3 months, not as a watchful waiting approach, but that same day. I'm not trying to be dramatic. I'm just trying to be practical. Now, before you panic, though, if you've seen pink-tinged or blood in your urine at all, there are 2 extremely common causes of this that I don't want you to get confused about. Now, the first one is beets. A notable percentage of the population, somewhere around 1 in 10 people, carries a genetic trait that prevents them from fully breaking down a pigment in beets called betanin. If you ate beets recently and your urine turned pink or red, that is almost certainly the explanation, a completely harmless condition called beetura. The second is a common over-the-counter medication called AO or phasopyretine. This is usually taken for urinary discomfort or if you have the symptoms of a UTI. AO contains a dye that turns urine a bright orange, because sometimes a reddish orange color as a normal and expected side effect, and this is not a sign of bleeding. The way to tell the difference is simple. If you recently ate beets or took AO, then wait it out. The color should return to normal within a day or two once the pigment clears your system. Even if you've taken azo or even if you've eaten beets, you still want to call and make that appointment, because if it goes away, you can always cancel. Now, the second urine warning color sign is a little bit less common, but it's one that every active adult should know, and that is dark brown or Coca-Cola colored urine. I've seen this color urine show up in someone who did just a light activity versus someone who did very intense and heavy endurance training. They pushed themselves hard from a physical standpoint and felt sore the way you typically expect after a workout. And then they noticed that their urine turned this dark Coca-Cola color. At first, they just assumed it's dehydration, and sometimes that assumption is correct. Remember that less water in your urinary system will concentrate the urine, which will make it darker on its own. Very dark urine can mean insufficient fluid intake. But after extreme or just unaccustomed exercise, particularly a large jump in someone's normal activity level, this color can indicate something entirely different. It can signal something called rhabdomyolysis, a condition where muscle cells break down and release a pigment called myoglobin into the bloodstream, right? Which then shows up in the urine as a distinctive Coca-Cola color. This is not common, but it's not rare either, especially among people who suddenly ramp up training intensity without adequate conditioning. Here's the practical rule. If you see this color, drink plenty of water first. If it does not improve, or if you feel unwell, weak, severely sore, or nauseated, you want to get checked out immediately by going to the ER. And if you genuinely cannot tell whether you're looking at urine that is dark brown or actually red, default to the previous rule and get it checked immediately. Do not try to guess your way through it. The third warning color is the most common one that I see. And the good news is that most of the time it's nothing to worry about. Urine warning color number 3 is cloudy urine. Now, cloudy urine on its own without any other symptoms is usually not a big deal. If you notice cloudiness and you feel completely fine, hydrate and reassess the following day. And it can simply be concentrated urine or a small amount of sediment, similar to the dehydration principle we already covered. But cloudy urine combined with burning, stinging, increased frequency, or lower abdominal discomfort is a different situation entirely. That combination points towards a urinary tract infection, and that is a same day doctor visit territory if you're able to do so. This matters even more for men, specifically because UTI are far less common in men than in women, which means when they do occur, they should never be ignored or assumed to resolve on their own. The fix to this is simple. Cloudy urine alone, flush it through water, and reassess it tomorrow. If you have cloudy urine plus any other symptoms, get it checked immediately. Now, before we dive into the rest of the urine warning colors and the one on this list that almost nobody has ever heard of, if this video is already starting to change the way that you're going to look at your urine in the future, please consider subscribing, as it really does help push this information out to the people that need to hear it the most. The fourth warning is subtle and one that many people don't even think about twice, and that is persistent foamy urine. A one-off frothy urine, especially first thing in the morning, is usually nothing more than the force of the stream hitting the water in the toilet bowl. But persistent foam that shows up day after day is a different story. That pattern can indicate protein leaking into your urine, which is a sign of kidney strain, wear and tear, or in some cases, early chronic kidney disease. And remember the earlier principle. Blood is supposed to stay in the pipes and protein is supposed to stay there too. This is not an emergency, but it definitely shouldn't be ignored. The practical step is to give your doctor an early morning sample, the first urine of the day, since that's the easiest to test accurately for protein content. Okay, now the fifth urine warning color is the one that's genuinely the most obscure on this entire list. And some doctors go their whole career without ever seeing it. Urine warning color. Number 5 is purple urine. That's right, you heard me, purple urine. Purple urine occurs in the context of something called purple urine bag syndrome, and it happens almost exclusively in patients with long-term catheter use, and most commonly in older adults who are bedridden in nursing homes. Not always, but most of the time. Here's the mechanism as to how you can get purple urine, and it's genuinely fascinating. Certain bacteria in the urinary tract break down an amino acid called tryptophan, producing two pigments. One called indigo, which is blue, and the other called indirubin, which is red. When those two pigments mix together inside the catheter bag, they create a striking purple or violet discoloration. It looks alarming, understandably so. Purple urine's a little weird, but it's almost always a sign of a bacterial urinary tract infection in the setting of a catheter rather than anything more dangerous on its own. It still needs to be addressed, since the underlying infection requires treatment, but the purple color itself is not the emergency. It's simply the visible signal that an infection is present. Now, if you've stayed with me through this point in the video, there are a few other colors that are worth mentioning here, although they are much less common than the ones talked about, besides the purple bag thing, which is very rare. One example is completely orange urine. I once had a patient bring this in, completely orange urine, after asking whether she had been eating orange colored foods, and it turned out she'd been eating carrots and sweet potatoes consistently around the clock for a week. Also, certain medications can produce dramatic color changes as, well, amitriptyline, a medication many people are already familiar with or currently taking, is a well-known example that can turn urine an unusual color. And there are certain medical dyes as well as other medications that can do the same thing. The practical takeaway with all of these urine colors is this. If you have any new urine color at all, you want to ask yourself these following questions. Have I introduced something new into my body recently? You want to go down that checklist. Has there been a new food, a new supplement, or a new medication at all? You want to stop that thing and see if the urine color changes? Finally, for you created, my inmost most being, you knit me together in my mother's womb. I praise you because I am fearfully and wonderfully made. This is from the book of Psalm 139, 13, and 14. Kink, in my next video, I go even one step further than just urine warning colors. And I talk about 7 warning signs of kidney failure that you can visibly and tangibly see long before it ever shows up on blood work. If you want to know what those 7 warning signs are to protect your kidneys, you're going to want to check out that next video right here.